As the vaccination rate rises to roughly the 50% mark here in Alberta and right across Canada, we are passing a slowing United States when it comes to the percentage of folks with at least one dose of vaccine. And that is raising question about herd immunity and whether we can get there, both here in the States and right around the globe. Joining me is pediatrician and infectious disease expert, Dr. Jim Kellner. Dr. Kellner, politicians and medical experts have long been talking about herd immunity being the goal for us to get it back out into the world. Is that still what we're aiming for, and is it really achievable?
Yeah, so it's an important question. And I certainly think that the principles of herd immunity we have to pay great attention to, and we have to strive to get as close as possible to some kind of perfect herd immunity. But whether we reach a perfect level of herd immunity where we completely control and eliminate any infections caused by SARS-CoV-2 virus, that may be difficult to achieve. And by that, I mean, I think we can get to a high enough level of herd immunity or community immunity where there's very few infections occurring, but we may not, sort of eliminate it completely. So it's definitely still a goal to aim for.
Okay. What needs to happen when it comes to vaccines to maybe get to that herd immunity?
Yeah, and so the thing with vaccines is, there's sort of different prongs to it. But the first is how well the vaccines work, and we know they work really well to prevent from getting one who's been vaccinated from getting really sick. And they also, though, work well, and we're increasingly understanding how well they work to prevent. Once you've been vaccinated, you might not get sick from the virus if it comes into your system again, but you could still potentially get it in your system and pass it on to somebody else who has or has not been vaccinated. And the ideal vaccine is going to not only prevent you from getting sick, but prevent you from getting that virus afterwards and passing it on to somebody else. And that's this prevention of transmission, and prevention of asymptomatic infections that can pass on. And so that we're understanding that the vaccines work really very well at that as well. So that's great. So the vaccine has to work to prevent transmission. Then you have to give out enough doses of the vaccine. And to do that, you have to say, well, who gets vaccinated? And, until a couple of weeks ago, we were vaccinating everybody over the age of 16 and above, which is 80% of the population, but not 100%. And if we're trying to get to very high levels of vaccination, 75% or so, it's, the number is arguable what we want to get to do that without giving any vaccines to 1 in 5 people, children under the age of 16, would be really hard to do. So now that we're starting to extend the vaccines down to younger age groups, it's going to make it a lot easier to get to that very high level of vaccination we need to aim for.
Are the new variants keeping us from reaching this idea with that 75% of vaccination?
Right. Well, this brings up the other side of the equation, which is what about the virus itself and its characteristics? And so there's 2 characteristics related to the virus. One is the biologic characteristics, and this is where, as you indicate with the variants, they're more contagious and they transmit more easily. And so if we want to try to prevent infection with them, we have to have a higher level in the community of immunity, either from vaccination or having had disease. And so that's a trade-off there. And that's what's sort of disrupted some of these thoughts of reaching herd immunity, because it looks like you have to get to much higher levels of vaccination against some of the variants. There's the other part of it too with the virus, which is the behavioral part. And by that, I mean, we have all these measures right now to prevent transmission. We're all wearing masks, keeping our distance, not gathering. All those public health measures actually reduce the contagiousness of the virus. And so once we are all super excited to get to the point where we can stop wearing masks all the time and gather again and not have the restrictions that we've had for the last more than a year. But as soon as you do that, you're going to put pressure on that level of immunity to protect us, because if we stop wearing masks and the virus can still spread, and if you have the variants, then it's easier to spread. And that's where then this goal of reaching herd immunity largely through vaccination becomes a little bit more elusive. But I don't think we should think that we should throw our hands up and say, well, we're just not going to get there, and so why bother? The higher the level of vaccination we can get to in the community, the better we'll do at controlling it. And one more thing to add about that is just that it's not all or none. It's not like we have to get to this high level of vaccination before we see any benefit at all. We're seeing here in Alberta, across Canada, and across the world that as you start to go up with your level of vaccination, you start to get that herd effect. It starts early and after even a relatively small amount of vaccination. And so it's definitely worth it to keep going.
Okay. Not to put you on the spot, and maybe you don't have an answer for this final question. Is, they've been talking that we're going to have a good summer. You're talking about the more people that we get vaccinated, the more, things we're able to do. Are we going to be able to get out there in the summer or even this year? Do you feel like we're going to get to a place with the vaccination and the herd immunity that we need to enjoy life again?
I mean, I don't think then by the end of 2021 that things will be perfectly back to normal. For example, I doubt, we might be flying on airplanes, but I expect people will be wearing masks on airplanes, for example, for some time. And I expect that, the size of gatherings that will take place and the sort of closeness of gatherings that will take place may not be the same. But, we're aiming for high levels of vaccine availability in Canada, and they really are starting to come. And Canada is really catching up to the rest of the world on a steep curve of getting vaccine doses distributed, and we'll be starting to distribute the second doses much more widely in June. And so we can look forward to a year in Canada where we have, as long as people are willing to be vaccinated, a high level of vaccination. And that's the best thing we can do to sort of aim to get back to normal. So nobody knows for sure how that's going to be, but as we get more and more people fully vaccinated, we'll be able to start to lift restrictions and allow more of the usual kind of activities that we all are wanting to get back to. I think it'll have to be incremental, though, in the sense that it's not like just overnight you can say, okay, you're just back to normal, forget about everything. Even in the United States, where they've taken this very liberal approach now, saying once you've been fully vaccinated, you can do a lot of things, but still that's in a place where there's a lot of infection still going on and a lot of people aren't fully vaccinated. And so there still has to be, in general, a lot of precautions taken. So I'm optimistic, though, that we're going to get to a much better place by the end of 2021 if we can keep moving forward in the way that we are. If we can get disease down to the lowest possible level now before we really let off. That would be a problem if we let off our restrictions too soon, and if we can get as many people as possible immunized.
All right. Thanks so much for your time tonight, Dr. Jim Kellner.